My name's Graham Aston. I'm 66 years old. My hip problem started way back in 2015. A few weeks later I got an appointment notice to go up to Vic, and hey presto, I met with Mr Javid. We had an x-ray and he confirmed that my hip joint was worn and I was experiencing some quite severe arthritis. The long-term prognosis was of total hip replacement. And he also said, which was delightful, at what time would be most convenient for you to have it done? I asked if it was convenient for the operation to be carried out at the end of September, and I got an appointment for the 4th of October, which was fantastic. I thought this was like being in private medicine, but God bless the NHS. In parallel with that, I got a phone call from Karen, the physio, and she referred me to this handbook that Mr Javid gave me, which is the Patient's Guide to Hip Replacement. And Karen walked me through the book on some of the exercises I need to do pre the operation, what to expect, and then we booked some appointments in post the operation. On the day of the operation, everything, I felt quite calm, and then one of Mr Javid's surgical team came to see me. I think it was Mr Shirivas who talked me through the anaesthetic procedure and the surgical procedure, and how the day was going to unfold. So into the theatre late morning, met by Mr Javid, who again explained what was going to happen, very calming hands, prepared me for the operation. The anaesthetists were all over me to settle me down. And then the next thing, I woke up in the recovery ward. I was fortunate enough to be put into a private room, which I didn't request, but it was great that I got the privacy of a private room and an ensuite bathroom. And that added to the whole positive experience that I was going through. Later on that day, on the Wednesday, I was visited by Diane, the hospital physiotherapist, who described the next couple of days to me, what she was going to do to me. But I just felt no hip joint pain, so it had just gone immediately. This is marvellous, I thought, this is great. On the Thursday, Mr Javid came to see me, had me standing up, looking at me geometrically, had a quick look at the scar, thumbs up, and handed me back to the Ward 16 team, who fed and watered me for the next couple of days. And they're just such great people, day and night staff. You know, the night staff came in and looked out for me as well. Within the next 2 weeks, I got the odd phone call for support, but the district nurse came to see me. A few days later, Karen came round, the physiotherapist, had a look at the wound, took me through an expanded set of exercises. Early December, around the 2-month anniversary of the surgery, Mr Javid sent for me. He said, I think your recovery is remarkable, and I'll see you again in another 4 months. One of the things that did concern me when I was thinking about this whole experience, particularly related to the news media, both television and the newspapers, where every time I switch it on or pick a paper up, I hear negative comments about the NHS. I think these are really, really unfair. And if they miss some of the targets by 10% or so, for me, it's why don't you talk to the people who have been involved in the 90%, you know, being successfully cared for compassionately cared for by the NHS. And I suspect there's a lot of people like me that don't get the opportunity to speak up for the NHS, because I think, you know, that there are a jewel in the crown in terms of healthcare for our society.
Thank you for sending this patient story to me. It is the first time I have had recognition and feedback on such a personal level. Patients always thank you when they are leaving and always send a card of thanks to the ward staff. However, inpatients' elective orthopaedic physiotherapy never receives such recognition. Thank you very much, Mr. Aston. It was a pleasure to be involved in your treatment and physiotherapy journey. And good luck with your new hip.